A very good afternoon to all and a warm welcome from my end as well as the California Hypnosis Institute of India. Dr. Akhil has already given my introduction and also assured you that I'm not going to hypnotize you and I'm not going to take anything. Well, that's what he was warning me to say, that I will be doing it. So you all can be assured that I'm not here to do a mass hypnosis. So you can lay your belongings beside and be more focused on what I'm here to share. Yes, I'm here to share and facilitate rather all that I have learned, understood, and my ideas and my experiences with this subject of hypnotherapy. Hypnotherapy as of now has not been into a mainstream medicine. For obvious reasons, hypnosis word itself, as we all know, the moment we hear, what does it create in each of us? Fear. Taking away control, taking away our belongings, or etc., etc., etc. There's so much of taboo associated with this subject. It is associated with myths, misconceptions of all kinds, which is one of the reasons it has always been away from a noble profession of ours. Also for other reasons, so this subject has never ever been introduced or rather talked about as being a part of a healing science. So I see this opportunity and I really thank Indian Medical Association for giving me this opportunity, for sharing my views, my ideas, my experiences with this subject, which is although not being a part of the mainstream. You all have given me this opportunity to share my experiences because I see a whole lot of possibilities of giving wonderful healing cures with this aspect of the science. It is a science. Unfortunately, it has been denigrated to a point that we all know that we are experiencing it whenever we hear the word hypnosis. So I'm here, I repeat again, the objective of this session is more of sharing my views, my ideas, my experiences and seeing it in the context of the today's world, today's medical scenario or the latest recent researches and where we can employ this subject, this learning, this knowledge for the benefit of the humanity, which is why I introduced this topic as hypnotherapy empowering humanity. We all are aware that the human system is an integrated organization of not just the body parts functioning or the organs or systems functioning in harmoniously, but even with the works of Robert Eder and Felton in the field of psycho, neuro, any guesses now? Endocrine immunology. It's quite a familiar word in the recent era where there's PNEI axis got spoken about a lot. And the works of Robert Eder has proved that the central nervous system and the immune system can actually communicate with each other. Mind is not just somewhere in one part. Mind is everywhere. There's a concept of body-brain. I'm just giving you maybe the highlights of these topics of researchers, which you all can go back and have your own connections. And this is too brief a time to actually talk about the immense detailed researches that have been conducted in this field, which is the upcoming field, which is showing that their mind and body are intricately connected. They are not separate, distinct entities. The field of psycho, neuro, endocrino immunology opens us that how mind or other emotions, thoughts, feelings have its impact on the body via the immunology, as well as we are all aware how endocrines influence the body. We do not need any kind of proofs. Do I need to expound on this part, or I think can I go to the next slide? Because I see that the crowd is quite enlightened. So the works of Robert Eder and Felton has already given us a hint somewhere that mind plays a huge role, or rather mind and body are so parallel to each other and they are intertwined. There is no distinct entity or no distinction between the two different entities, which is where it's easy for us to understand that if the body or the human system is so integrated, the healing can be integrated as well as our living. So what I did is I simply simplified this psycho-neuro-endocrine immuno-axis, which we can make it in our simplified aspect that anything and everything, if it is happening in our body or physical reality, let's go reverse, begins somewhere with the thought, which in turn influences our emotions. So thought and emotions are intricately connected, which in turn influences our energy body. This is something that maybe the medical world may not be very aware of, because we find this all these funny when people talk of energy body or they talk of aura and chakra. But with the latest technology, it is possible for us to have an aura photography. We can also see the chakras. Chakras, for all those, if some of you are not aware, these are energy centers which are at the interface of the thoughts and emotions in the body. They are located, there are 7 major chakras which are located along the spinal cord, corresponding to the glands located in that vicinity, which shows us the connection between the emotions, the energy system, as well as the endocrine, the immune, as well as the body. So this gives us an insight that anything and everything that happens in the universe, or rather in our universe, to be more precise, in my reality or in my body, somewhere has its origin, somewhere has its connection from its thought. And I have several cases where we actually see a parallelism running between the mind and the body. The body speaks what the mind cannot express. A very interesting case that I had of an infertility, again of a doctor. I hope she's not around because she would say I'm discussing her case. She had been trying all possible measures to conceive, and both husband and wife being doctors, and they obviously would have gone through every possible gynecologist or made efforts to find out why things are not working. They started with the IVF, etc. But things are still not working out, and we were working with this approach when it was possible for us to understand that at a certain deeper level, her belief was that I have a certain male part within me, which could understand, which could explain us that why she was not able to conceive. The moment we could help her with that thought process, that belief, it was possible for her to facilitate the function of the femininity, which is reproduction, and which is why she could deliver. She's conceived, she's delivered. I think the child is around a year now. So this is what is possible for us. This is only one-off example. Maybe at some other time and space I can share more experiences. But this is to give you an example of how mind and body works in parallelism. And it is possible for us through the body get into the physiology of the belief, which is ruling it and expressing or presenting its manifestation at the level of body. And the same goes to applying when something is not happening in our physical reality. Well, we as medical professionals are always limited to heal at the level of body, but it is quite possible for us to go one step ahead to give them a sense of well-being, not just at the level of body, but even at the level of social well-being. So, can we go to the next now? The biology of belief. Apart from this recent researches in the psycho-neuro-endocrine immunology, researches have been conducted in this area, which is the biology of belief. When I say biology of belief, studies have been conducted on placebo effect, and many a times we medical professionals simply laugh over it or we ignore it because it's a placebo effect. But the fact is, placebo plays a lot of role, an immense role and a strong impact on the person's psyche, to the extent of even healing. People have conducted placebo surgery and they have found same results, rather better results than people who are already been operated in a real way. So the studies of the placebo effect through placebo medicine and placebo surgery have shown that the healing comes from within and the placebo is mere prompt. Isn't it very interesting? When I read it, it really shook me and it touched me a lot. That means we have an immense healing power. We all have an immense healing potential which can be channelized. And we often see that when it comes to our daily practice in our clinic. A lot of people just feel better when they see the doctor. What is that? That's a placebo effect. The way they relate with the doctor, the way they start feeling better the moment they are in the doctor's cabin. And many times we give them simply vitamins and they are okay with it. There was another physician, Harvard physician Henry Beecher, somewhere around 1955, he conducted this study. And it was again his study which showed that he reviewed around 15 double-blind studies were conducted. He reviewed all of them, and each of these studies showed that all those who were given placebo were showing remarkable results. Out of 100 people, there were 35 people who were responding beautifully well, irrespective of the condition. Maybe a headache, it may be a functional disorder, or it could be even any other related events related to the bowels. And his study again was giving us a question, which was again a huge question that we as medical professions really need to ponder on. Is inner controlled healing different from real medicine? Is it just the drugs all the time that are helping us? Or there are a whole lot of other aspects that go along with the medicine which are prescribed, which goes into the healing of an individual. Which tells us that the expectations and the beliefs of the patient influences the outcome of the treatment. Many times people come and tell us, give me injections, don't give me medicines. What is that? They come and tell us, give me that pink medicine that works better for me. So again, this only tells us that what they believe or what they expect influence a lot on the outcome of the treatment. Our philosophers have also wrote, it is a part of the cure to wish to be cured. A lot of healing occurs because somewhere deep desire is there within an individual to get better. Well, it's not just the philosophers, but there are books written on that. Any of you might have read Anatomy of the Illness. Anatomy of the Illness is a book written by this American journalist, Norman Cousins. He was suffering from multiple sclerosis. We all know what multiple sclerosis leads to. He was almost crippled, quadriplegic. It's interesting to read his experience because the entire book simply explains about how the chemistry of the will to live can pull the person out of this kind of life-threatening, crippling illness. And he was back on his two limbs, only on few doses of vitamin C and his will to live. So if we have all these experiences, this is one of them, I'm sure there are many. We have heard about the spontaneous remissions with tumors. Again, these are the articles that we have, but they become like a rare commodity and they get somewhere beneath the pile of our other records, and we easily ignore it, not keeping in fact that even these are the areas that we can understand. If these people can do it, why not large number of other people can do it? And how do we make it is what I'm coming to. You all might be wondering, what am I doing in a class of hypnotherapy? Well, this is something from where I started my journey into taking hypnotherapy as a serious science. So I thought I'll share it with you, because unless we understand what human potentials are in the healing process, we would never be able to acknowledge hypnotherapy or hypnosis in that context. In fact, many of the drugs which have been proven have been known to have its effectivity or impact just because the people started expecting, or they thought this drug remedy or this remedy works better for me. So it's not just the medicine per se, but the patient's belief And very, very important. Any guesses? The doctor's belief, the persona of the doctor that goes into influencing the entire healing process. And very, very often we ignore this fact when it comes to the knowledge that we all gather. We are so keen to put that knowledge in practice that these are basic things that go into building up or rather facilitating a healing or a cure. And that's where this word placebo halo came, wherein placebo halo is actually the patient's expectation that this particular drug will help. In fact, many a times it's not even the drug, it is the therapist or the doctor who's treating me. I know he or she is going to be taking care of me. I happened to visit one of a very senior physician's cabin along because one of my friend was not well, and she said, let's visit this doctor. And I was like amazed. This person of mine, this friend of mine, was suffering from anxiety neurosis. She's a doctor herself. She was taking all kinds of medications, not responding. So I took her to the senior physician who's practicing at Malad, and his words really touched me again. He said, it's not the fear, beta, it's the faith that heals. Well, I don't know how much did my friend really gain out of it, but yes, I gained a lot. And which is where it reinforced my belief in the system, that it's the faith. So it's the faith that we can facilitate to the client or our patient. At the same time, the faith in the patient can facilitate this healing process. So when it comes to hypnosis or hypnotherapy, now we understand why people are not able to get the relief, or why we are not able to facilitate that relief using this hypnosis process, because there is so much of fear, there's so much of doubts, there's so much of questions, there's so much of misconceptions that we all are carrying that same baggage around with respect to hypnosis. Which is where I needed to tell you that this is what is the foundation of the hypnotherapy that I practice, or we all can practice. So the integrated clinical hypnotherapy works only on a willing client. Very, very important. It cannot work on anybody who's not willing to get hypnotized. So when I generally start taking up cases, or my first thing is not to take them on the chair. The first thing is to understand what he or she is suffering. So it almost takes around 20 to 40 minutes, which is again never less than that. Following which, I get to know whether the person's interest is there or not, and then we explain to them how it functions, how it can help you, which is then he feels that no, I can do something, and that's where the process of hypnosis starts afterwards. It's a drugless healing facilitated through thoughts, emotions at the level of chakras and body. So the hypnotherapy that we practice is a drugless approach. So obviously there are no side effects, there are only effects that one can make benefit of, or rather what we are cashing in on is simply the healing potential of an individual. It operates accessing the hypnotic or the subconscious zone state for healing. I'll come to, in a while, the later part of it. What we are doing in hypnotherapy is accessing the subconscious zone. Subconscious zone is something which has all its experiences of everything that has happened to us in the form of thoughts and feelings, which is how we can access the origin of the disease. And what we do through hypnosis is we help them to release. So basically what we take is through different stages of catharsis, letting that feeling, that disturbing feeling or thought, following which we restore them to a state of peace with that feeling. So obviously he's accepted that and he's let go of it, and if required, reframe it or have a positive visualization or a creation. So once the thought and the emotion are altered, obviously it is going to percolate down to have its corresponding positive effect on the body. Well, when we all feel that this is something worthwhile to practice at this juncture, we all need to be aware that it is also a validated, legally practicable alternative therapeutic modality. As it always happens, the Western world always starts with something and we go into following them. So it was laid back in 60s that the Western world has already recognized hypnotherapy as a valid science. Well, of course, the application over there is also limited, sporadic. There are hospitals who have hypnoanesthesiologists. There are people who are appointed for sports medicine and they are all coming from hypnotherapy background. But as of now, I don't know how many of us or how many people from the West are actually really applying it in all possible illnesses. Which I feel that it is quite possible, because as you start seeing the deeper aspects of the mind, it is very interesting to know that somewhere the origin lies in our own mind. So under the Drugs and the Remedies Acts in the 2003, in the year 2003, Indian Constitution has now recognized as a legally practicable alternative therapeutic modality. So it has the same recognition as any other alternative healing branch. So if we feel it is worthwhile really practicing, it is also very important for us to understand that as of now there are two schools of hypnotherapy. And all that we hear about hypnosis taking us for a ride, manipulation, control, all is belonging to the Eastern hypnosis. What I have been discussing is the Western approach. Well, to be very honest, Eastern hypnosis is something that we all also need to revere. Unfortunately, it has been over a period of time denigrated. For people started misusing their power, which in the context of Western hypnosis is less likely once we understand what are the differences between the Eastern and the Western hypnosis. Eastern hypnosis is to taking away control by manipulation. So there is nothing like an informed consent or a choice given to the person who is receiving it. And that's why when we hear these kind of incidences that I'm walking along the platform and somebody just asks me what's the time and they touch me somewhere here and there, and in the jiffy I'm out following that person and I'm without my wallet and my watch and my gold chain. This is all to do with Eastern hypnosis, which is to do with thought transmission. So they actually transmit thoughts. And again, it is through a systematic technique, but these techniques are using certain sore points, and a lot is to do with the power of the hypnotist. And there is a complete loss of control of the client's mind or the patient's conscious mind. So he's completely knocked out. As against which the Western hypnosis, well, before I go to Western hypnosis, I told you that Eastern hypnosis is also not something that you can simply knock it off. If you are aware, the Eastern hypnosis comes from our Eastern world, wherein in the Vedas it has been mentioned in our scriptures that the Rishi Munis would actually transmit the knowledge through Eastern hypnosis. So you know how with the time as things have got into a devolution mode, even the Eastern hypnosis has lost its beauty. Otherwise, it's quite possible to use that technique even for the sake of healing. But the way things are now turning out, it's not advisable to use that technique because it has a lot of loopholes wherein there's a complete loss of control and people are made to do things which they don't want to do. As against the Western hypnosis, the control is not taken away from the client. The control is shifting from the client's or the subject's own active part to the dormant yet powerful part of the mind, which means there is a transfer of control. All the time there is a conscious mind control. If I have to do something, if I feel something, there is an inhibitory mechanism that we all are endowed with. We all are aware of that, which we understand in terms of autonomic nervous system. So that's all the time there. There is all the time central nervous system, peripheral nervous system, which is keeping our control all the time. When we take the person in the Western hypnosis, the control is shifting from the active part to the person's dormant part. The dormant is the part which is the subconscious zone, at the same time a very powerful zone of mind. So Only his central nervous faculties and his peripheral nervous systems are dormant. Again, I repeat the word, they are dormant. They are not stopped. They are not interrupted. They are simply kept at rest while the autonomic nervous system is on. As against the Eastern hypnosis, there is no thought transmission. Suggestions are placed with a consent. There's an informed consent. There's an information sheet which is given to the client or the patient, after filling which they give us a permission. So it's like a preparation that we do for any surgery. The technique is again very systematized. Systematized and a standardized technique. So it does not have any criteria for the hypnotist, that the hypnotist has to be powerful. A 17-year-old to a 70-year-old can carry on this technique. And it is duplicable. Whether I do it or you do it, once you learn it, you can also do it. So each and every person is able to access this technique. It is very precise. It's quite a scientific way of handling it. When we learn the technique, probably in the workshop, then you would know how beautifully they have used the human system for creating that hypnotic state, artificially inducing it, wherein it's going to be very precise. If you can create it, that means it is very much safe, because you are artificially inducing it. It's very controlled in comparison to the Eastern hypnosis. If the person is wanting to come out of the state, he or she is allowed to do that. Nobody gets stuck anywhere. The loss of control of the conscious mind is precise, very specific, to the extent of the desired pre-decided outcome, which means there is no complete loss of control. If I take anybody under hypnosis for a particular issue, for a particular problem, he or she loses the control only in that specific area. So I have the concern to handle the person or heal the person in that area. But suddenly I decide during the session that I want to take up something else, or I want to put a suggestion of a different kind. I can't do that unless that trust and rapport is there and a consent is there that I can do it if it is required for my healing. So it's a very precise, a very specific loss of control based on what has been decided, desired, pre-decided outcome. So this is the difference between the Eastern and the Western approach, which I think we all need to be understanding it. At least at the end of the day, if we are aware of it, a lot of our anxieties would be at rest, and we can really think about orienting and aligning to this system of therapy, which has a lot to offer for us as well as for the clients. So if we need to understand further more about hypnosis, it comes from the Greek word meaning nervous sleep. It was coined by James Brett in the year 1869, and he studied the work of the pioneer of clinical hypnotherapy, who is Franz Anton Mesmer. That's how the word mesmerizing comes. If you all know, hypnosis to do with mesmerizing. Now the mesmerizing comes from the father of clinical hypnotherapy, Franz Anton Mesmer. He studied the shamanic healing art. It's actually a tribal healing art, a healing art practiced by tribes of South America, somewhere around 1600. Mesmer studied that. He gave this name to this process as animal magnetism, because there's something magnetic about the whole process. After which it had been used by a lot of practitioners. Very interesting, Mesmer comes from the mainstream medicine. He was outcasted because all that he was using for the psychiatric cases. Following which there were surgeons who were practicing it again, but not knowing the scientific background behind it. So they conducted painless surgery. That was Elliotson and Esdell. You can actually Google search and find out these names, and they will get to know what they did. But there was no scientific validation till James Braid, again a doctor, and he studied this entire process. What is this process doing to people? And he coined the word hypnosis. So it is no more as an animal magnetism. There is nothing animalistic or magnetic about it, but it is about inducing a state like sleep, a nervous sleep. In sleep we don't get nervous, but in hypnosis is a state wherein there is a nervous state a little nervous state, and it's a sleep-like or a trance-like state. So let's come to what is it. So if we need to now understand quintessence of hypnotic state. Quintessence means something that gives you the essence of the hypnotic process without which it cannot be. So it is the key aspect of the hypnotic state. So if you really need to understand what happens in all kinds of hypnotherapy or hypnotherapeutic process, James Braid's study states that whenever an individual is subjected to this process of hypnosis, so mind the words, it's a process, it's not a magic. It's a process of hypnosis, then he or she gets unusually susceptible to impressions made on the senses under the hypnosis. So whenever the person is subjected to this process, he gets abnormally or unusually impressionable. He gets easily influenced, which is why we see people start doing things which they are not expected to. But when we are doing it in the context of therapy, there is a pre-decided outcome that we are looking out for. It is done with a consent. So once the person gets impressionable, which means he takes all these impressions through his 5 sense organs. He becomes hypersensitive to what is being told, what he feels, what he smells, what he senses in that space. As a result of which, the behavior gets altered. And we want this thing to work even out of the hypnotic process. So when he is brought out of the state, he is continuing to remain in that state. I'll repeat this in a one go, and you can take time to simply contemplate and reflect on this. Because if we understand this, we've understood what hypnosis does, and we can make the best use of it. So when an individual is subjected to the process of hypnosis, he or she gets unusually susceptible to impressions made on the senses. All the 5 senses are involved. They become hypersensitive, as a result of which the individual's behavior gets altered, and he continues to remain when he is brought out of that state. So this is how it works. And what happens in that state? So it's a state wherein a person is hypersuggestible. He takes in suggestions which are given by the hypnotist or the hypnotherapist, wherein his senses are heightened. He can feel, he can visualize, he can see, he can hear. In fact, a hypnotic state is such a sensitive state that the person doesn't get knocked out. On the contrary, the person is aware of all that is happening, which I or you can't hear now. If he's taken in the space right now, he can hear distance from probably coming from the beach side. It would be that level of sensitivity. And he becomes open to receiving suggestions from outside without any resistance. So there is no resistance. Otherwise, if suggestions are given to us by a friend, by a relative, or by a counselor, how much time do they stay within us? No. Which is what happens to our New Year resolutions. It just doesn't remain there. But if these suggestions are given at the level of subconscious in this space, then they become more receptive to, and they can bring about a necessary change without any resistance or any inhibition from the conscious mind of a willing individual. So what is it to be in the state of hypnosis? Oh, it's a wonderful state. It's an altered state of awareness or consciousness. So it is neither sleep nor awake. We are aware of 2 states of consciousness. So what is it? It's a sleep-like state. But it's a state of complete relaxation with utmost concentration. How many times do we really feel ourselves relaxed when we are focused? When we are trying to focus, or we are concentrating on a subject? We are all the time on the edge. Which is why the word nervous. But it is not just nervousness, but it is a nervous sleep. So in hypnosis, one experiences a sleep-like relaxation with utmost concentration. So entire consciousness or awareness is focused on a particular aspect which he or she is willing to work in his own individual space. If you ask somebody out of the hypnosis, how is it feeling? Oh, it feels great. So it's like a meditation. It's like a trance. where all your scattered energies are brought to the focal point of awareness. This is what people have mentioned, and this is what people have experienced. So it's a state likes of meditation, a meditative trance, wherein all your energies, everything that right now, if I'm standing here, I have 10 different thoughts coming, or we all have our mind wandering everywhere. In the state of hypnosis, all these thoughts, emotions, energies are brought to a focal point of awareness. So you can imagine the kind of power and the potential that thoughts and feelings can empower us, as well as disempower us. So where is this state seen? Now this is something that you would feel, oh, I have experienced it, what's great about it? But that's true. There's nothing actually great about it. Somewhere we experience this state in our natural day-to-day life, in health, just before going to sleep and immediately on waking up. When we are about to go to sleep, we have switched off the lights, the room is dark, somebody is entering the door, and we can feel it, we can sense it, but we can't move ourselves. No, it's a little dazed state, which is a hypnotic state. We call it hypnoidal state. We know why hypnoidal, or it is similar to hypnotic. And immediately on waking up, just immediately on waking up, when we open our eyes, and we are in that still the state of integrating ourselves, bringing us back, which is again a hypnotic state. And if you might have observed, or a lot of people would be aware, there's a program going on by the name of Infant Siddha program, or even otherwise, a lot of mothers use this sleep just before going to sleep stage to do sleep talking. And sleep talking is simply to transfer all the information very easily into the subconscious space. Because when you are about to go to sleep, naturally there is a transfer of control from your conscious mind to the subconscious mind. Your conscious mind stops thinking and you are about to let go of that control to the subconscious mind. And when you are about to wake up, your control is coming from the subconscious mind back to your conscious mind. So it's that transition phase which each of us experiences it, and we miss it out. Very classically, we have been using this space just before going to sleep. Many people have this habit of praying, giving positive suggestions, and it works beautifully well, or even immediately on waking up. And what are these suggesting? They're simply suggesting that these are natural hypnotic states that we are going in and out every day, but we miss it out in our daily humdrum of life. We also experience it in the meditative space. All those who meditate will definitely find that this is something like, or rather hypnosis is like being in a meditation, and vice versa. Hypnosis is actually happening every day in and out. If we understand further and understand and analyze the whole process, it's happening every day in and out, every moment. There's some amount of quasi-hypnotic state. We'll be amazed when we get to know a little more about this. Now, hypnotic state also occurs in disease conditions, which is, we all know, person getting into a delirious state, he's operating out of his subconscious space. But why does that happen? We know it from the chemical point of view. We know it from the body point of view. We know from the anatomy and the physiology point of view. Because of the toxic effects of the chemicals and the drugs. There is a disoriented state, delirium, because of electrolyte disturbances, CNS disorders, drug dependence, drug-induced states. There are delusional states that we see in schizophrenia and schizoid kind of personalities. And the third very important state that we can experience hypnosis is in a therapeutic intervention. So we have experienced it in our daily life. We have noticed it in the disease. Why can't we make the best use of that in the therapeutic space? So now if we have to understand the hypnotherapy as a process, the process has 3 stages. Induction. So generally whenever a person comes to us, I don't start taking the person into healing it. What we do is we induct the client. For anything that you need to start, We have in these religious communities, there is something called as initiation. The same way we induct a client, we give them a feel of the space. This is induction, so we hardly do much of therapeutic work. At the most, what we do is we place suggestions, positive suggestions in that space, only with the consent. So we discuss what suggestion would you like to put. Again, this is with an informed consent. And in the subsequent sessions, then we take up different techniques wherein we regress the client into their past experiences and we do the resolution work. So that's a deeper state. Well, induction is also a deep enough state, but as the person starts habituated to go into that space voluntarily, then for him to get regressed as well as to work becomes easier. So he starts going deeper on his own. We help him to do that. So our intention or our purpose is simply to help and not to take away the control. So when he keeps going into this past experiences, it is simply to find out the origin of the illness, which we generally do it, in the cognitive frame. Whenever the first time people come to us, we say, what is your ODP? Origin, duration, progress. So they know it at the conscious level. Very surprisingly, there are people who regress into their childhood and further beyond. And they get to understand where was that origin of that belief or a thought or an emotion which they are continuing to suffer or go through even now, along with the illness that they have come up with. And it's very beautiful to see, how the entire common thread of thought and emotion keeps flowing. Now, how do we induce or how do we induct? Through a conventional route. So when I say that, it's again a technique that we need to learn and practice. So what I'm doing is right now I'm simply introducing you what are the different ways that we can do it. And maybe when there's time and space, I'm sure we all can learn it. The conventional route is through standardized, duplicable steps. Again, very scientifically done. We explain to you how it happens. Triggering the fight-flight mechanism. Is it ringing bells in your mind? Fight-flight mechanism is triggering the autonomic nervous system and allowing the access to the subconscious mind. The subconscious mind is known to control the autonomic nervous system. So there is a conventional route by which you induct the hypnotic state and non-conventional route. We have introduced this simply because by and large all over the world when it comes to hypnotherapy, it is the conventional route that they are more familiar with. In the integrated clinical hypnotherapy, which we practice and we learn in the California Hypnosis Institute of India specifically, we are introducing these techniques as well. And these are wonderful techniques. Believe me, they are wonderful techniques. I can only give you that one word and you have to trust every word of what I say. So the non-conventional route is through the emotional empowerment technique. This is a technique. Emotional empowerment is a modified version of a technique. Again, not using any drugs. Simply using certain endpoints of the energy body of our body. You know that the human system is again a biomagnetic energy field. So tapping certain endpoints and simply by very simple steps, you can help the person to take care of his emotions in that time and space, in that moment itself. You don't have to wait till he goes out of your cabin. The other is using the medium of energy healing. This is not something mumbo jumbo. Okay, this is something again very scientific and which has been proven. So it works through the energy healing or placing the pendulum which is sensitive enough to the flow of energy in that part. And how does it help us? Simply by assessing the flow of energy through that part, one can get to know what's the corresponding influence on the endocrine gland in the vicinity, which will also give us an insight into the disturbing thoughts and emotion in that individual. So it helps you to access, in short, the feelings and the experiences in the subconscious mind. So these are the different techniques or routes by which we induct a client or generally give them a space of hypnosis through which in the first conventional route there is simply an experience and we place a suggestion. In the second route it is quite likely that the person regresses right from day one. It's likely, it's not all the time. So these are such powerful techniques. Now, how do we know that everything that is happening to the client is not fake? And that happens through physiological signs. There are telltale signs that you would know by which you can make out that the person is getting into a hypnotic space, which is the alteration of the breathing pattern. There are certain specific eyeball movements by which you can make out, and then the feeling of dryness in the mouth and the throat. Now, very important, how do we apply and where do we apply this process? Applications of hypnotherapy, as we all understand it, are in psychological issues like of anxiety neurosis, behavioral disorders, drug addictions, fears and phobias, post-traumatic stress disorders, as well as enhancing the effects of cognitive counseling. Now here there are no two questions, or it is undisputable that hypnotherapy can work at this level, because we know we are working at the thoughts and emotions. In fact, I have majority of my cases are belonging to this realm, because people are still opening themselves. They are still taking time to have the trust and faith in this. So practically every day I have some sessions related to this. So it's very easy to work with hypnosis in these issues with wonderful results. Psychosomatic disorders. We know now 95% of the medical illnesses are now becoming psychosomatic. Irritable bowel syndrome and etc. So it can be an adjunct to the medical line of treatment. So we can use it as a complementary modality. Lot of people come for personal growth. As of now, or maybe till date, lot of people even in West have been using hypnotherapy for their own self-development, which is why it was not coming to the medical profession, or it was somewhere more away from it. So people have been using it for their mental, for their social and their spiritual well-being. They use for their personality enhancement, for public speaking. They use it for their stress management. A lot of corporates have been employing these techniques. So people use this space, hypnotic space, for their spiritual growth. This is something that we can start looking into, which is what I started looking into, because the first three are quite obvious. There are resistant illnesses. There are a lot of multi-drug resistant disorders coming up now. Now we will understand, if we get into the deeper workings of the human psyche, why there are certain infections which are coming again and again, and they are not responding with the best of the medical line of treatment. And since we know that it's not only the medicines, but even the will to live, a lot of the wish to get cured, a lot of person's individual healing potential that comes in the play, it is quite likely to employ these therapies there, wherein we are not using a drug, but we are simply encashing, empowering the person's healing abilities. And to understand why did he choose this illness? It's again a very interesting subject, that illnesses don't happen to us unless we choose it. So these are recurrent infections, relapses that can be treated as a complementary to medical approach. Autoimmune disorders. Again, these are cases that I have worked with. So I can very well conveniently say that yes, this is one area that you can start helping. RA, rheumatoid arthritis, it can be worked as a complementary approach. SLE, I already have a case. Again, it's a very, very tough case. Just to brief you up, we all know it's an autoimmune condition. This lady has been suffering for the past 15 to 20, I would say rather 18 years to be more specific. She was on all kinds of drugs. She was on steroids. She had come down to Azoran when she came to me. And this lady has attempted suicide. She was on psychiatric medications. So we can imagine the kind of psyche that she is coming from. Very interestingly, when we were delving into her process of healing, we found out it was her own love marriage that has been working against her. So it was her own love quotient which is working against her. And that's what autoimmune are. They start becoming anti their own things. Autoimmune, to make it in a very simplified version of it, we start working against our own immune system. And we actually go into the story of this lady. She started having illness since the time she got married, and she got married to the person whom she started loving. And she was mad in love to the extent that even now, when there are great issues in the marital relationship, she just finds it difficult to let go of this relationship. It's almost inviting her own system to work against her. This is simply an example of how mind and body work in parallelism. Then there are allergies and there are hypersensitivity disorders that are also possible, that we can work with these conditions. This comes to more or less the summation of where all we can apply. So I have a lot of hope, and friends, I feel that this is something that we can see as a new age therapy, of course complementary to medicine and even independently. There's an effective therapeutic modality in facilitating restoration to a state of health and harmony. We always view disease, or rather, we always view health as absence of disease. Well, when we go to PSM textbooks, and which has always been my search, honestly, from the time that they have passed, that I see this definition all the time, but I don't know whether I'm really doing it or not, whether I'm able to do it as a healer or as a therapist or as a doctor. And I found that hope in hypnotherapy, which is why I can't resist but again reiterate, the health is defined as state of physical, emotional, mental, social and spiritual well-being. So we can have a radical healing in true terms, and to some extent, yes, I have tasted this for myself, and I have tasted it through my patients. So my belief is great, and which I wish I can really help you all to even have that same belief, so that we can work more and more for our human fraternity. While I was working, I came across this wonderful proverb, and I couldn't find the author of it, but it was very interesting. The inferior physician takes care of the illness after it manifests. The superior physician cures illness before it manifests. Well, I would like to make a little alteration. I don't believe anybody is inferior or superior. So if I get a chance, I would alter it and I say, yeah, any physician would take care of the illness after it manifests. But an aware physician and an open-minded physician can cure the illness before it manifests. And we can do that with hypnotherapy. If we can really facilitate a complete, holistic, integrated healing, it's quite possible for us to live in a world which is healthy and having a harmonious existence. Well, you've heard a lot about what hypnosis can do, so I'm sure you would be interested to know what courses are available or what could we do so that we can learn this science. And the California Hypnosis Institute of India conducts these courses in integrated clinical hypnotherapy. There are 5 steps in the curriculum. The step 1 is the basic course in the integrated clinical hypnotherapy, which goes for 3 days. I have given you the brochures, and the brochures have the contents of this level 1 course, which has a basic introduction about how mind functions. So it's thoroughly scientific. It explains to you about what is the conscious, subconscious mind, how you can use it so as to understand the hypnotic process, which I did give you in brief today, and as well as learning techniques of induction, the conventional route. That's what we do it in 3 days course. Whether it's a tough client or it's an easy client, there are different types of subjects. So we explain to you how do you use different techniques for different kinds of subjects. And then you learn self-hypnosis in the first level, after which you can also teach self-hypnosis. You are certified for that. The second course is the Integrated Hypnotic Modalities and Behavioral Resolution course, which is a 5-day course. This again opens you to several techniques to access the subconscious zone. The contents of this course are again mentioned in the brochure. I take up the level 1 and level 2 courses. So I have given you the contents of these courses in detail. The integrated hypnotic modality and behavioral resolution will open you to different hypnodiagnostic tools. It will introduce to Ericksonian hypnosis. Erickson has been a legend in hypnosis. He has been actually hypnotizing people simply by conversation. So you would be opening yourself to the whole world of that. as well as there are different other techniques, and we use a little bit of NLP and graphology, as well as hypnodrama, and there are certain other therapeutic modalities that you would learn, which will probably at the end of the 5-day course you would be able to then start taking up cases on fears and phobias. And you will be able to access the subconscious issues of the client through the various techniques. Then there is an integrated healing course, which is for 4 days. This course opens you to a metaphysical realm beyond the physical world, because we haven't experienced how it is to heal through emotions, or how it is to heal through energy, or even through body. Simply by a technique which goes by the name of rhythmic relaxation therapy, it is possible for us to access the subconscious feelings, and it's a beautiful technique to explore. We only touch the patient when we want to examine it. This is one other area that you can touch the patient and use it for the therapeutic purpose. So this is a 4-day course which will open you to a metaphysical realm, or the metaphysical aspect of the human persona, which is also important for us to understand why we invite why individuals invite illnesses in their life. In other words, we are responsible for our own illness. And there are several books for it. As a practitioner, I think, well, this is not a part of the curriculum, but it would be worthwhile going to these books of healing power of the illness, which opens us that every disease at the level of body has its own language. It has its own emotional syndrome, which is very well explained in that book. Then there is integrated regression therapy and foreign energy dynamic course, which is again a 4-day course, simply because once you have understood the different routes to access the subconscious zone, there are times you need to go further into the deepest zones of the mind and access from where the origin has been. So it takes you into a past life therapy. For all those who are not believing in past life or believing in past life, the idea is not to promulgate any kind of belief system, but simply to open yourself to facilitate the person entering into the deepest zones of his mind so that he can heal his disease. Interestingly, if we can all go on and on, there are cases that you can heal with the past life therapy. And of course, the last course, which is the step 5, integrated clinical hypnotherapy. It's an 8-day course. Whereas practitioners, it would be interesting for you to learn in this topic how to handle addictions. Something more about the psychology part that you would be introduced to, handling relationship cases, and so on and so forth. So this is in short about the different courses. The brochures that I have given to you has the level 1 and level 2 topics in detail. These are the 2 courses that I conduct on behalf of CHII. If there's something more that you would like to ask, because we are almost on to the conclusion of this course, and thank you very much. Thanks for being a part of this course. Well, there is no criteria for that. You can start learning it from 18 years.
No, not learning. Receiving. As patient.
Sorry, as patient, we can hypnotize. There is a subject of child hypnosis in level 2 course. So you can hypnotize a child, even a baby, but in a way, if you look at it, you did not hypnotize a baby because he's already in a hypnotic state. He's already existing in that state. It is only after 8 to 10 years when we start taking instructions that you can hypnotize a client, a child client. And otherwise also, when we take up child hypnosis, you would know that child is already existing in that space. So you can start from 10 years onwards if you really want to do that. I generally take a lot of students come to me for examination anxiety. Writer's cramps is something that I have been handling in children, in professionals. There are 2 cases where it has worked beautifully well. So these are the areas that you can very well work.
Where you do these courses?
I conduct at Andheri West. Generally, I have been conducting it at BJN or at Parkview. So we work on behalf of the institute. The institute has the office at Andheri West, Warsaw, and I take it on a different ground. So we work in association with them. The certificates come through them. So that's how it is. California Hypnosis Institute of India. It's at Warsaw, the center opposite at Warsaw. You can write down the website address if you would like.